Hey, it's Steve Marshall from Jenny and Friends, and I get to be the one to sit down with Dr. Pyle Kohli. She's Harvard-educated, 9 News medical expert, and she's taking new patients at Cherry Creek Heart over in Aurora. Dr. Kohli, hello.
Hi, Steve. Nice to see you.
Nice to see you. So let's talk poop.
Let's do that.
Let's get right into it. I know everybody's inner 10-year-old just started giggling to themselves a little bit. But there's been a lot said about how often we go and consistencies and look of it and all of that. So what would be like a good average for people to do?
You know, we're realizing the science of poop is actually quite fascinating. Tells us a lot about the health of your overall body. And we used to say that healthy can range from 3 times a week to 3 times a day.
Right.
But there's new data that's actually telling us the more you poop, the better.
Okay.
And usually you should try to go about once a day to be kind of a high-level pooper. Now, only 40% of men and about 33% of women actually go once a day.
Really?
But that's really the goal that we should be shooting for. And we should be thinking about how to alter our diet so that we can try to achieve that goal, essentially.
Is there anything to the old saying about people going at the same time? Because full disclosure, I'm one of those people that's like same time every day.
Okay. And what time is that?
Usually like good half hour after I get up in the morning.
Perfect.
Had a cup of coffee. Yeah.
Excellent.
And the system's like, all right, time to go.
So you are the A+ example of what you should be doing. And that's actually called the gastrocolic reflex. So when we eat something or drink something, and caffeine has a mild laxative effect as well, it distends the stomach, which triggers a chemical reaction and a mechanical reaction that causes our stool to come out. Now, most of the times we suppress that when we eat lunch or we eat dinner, but the behavioral part of training your neurons to go at the same time every day really does help with consistency, helps with frequency, and helps sort of train your body how to do it. The way that you should be, defecating or pooping every day is like a cup being turned over.
Okay.
So it should come out easy without straining, without pushing, and it shouldn't look like pellets. It should look like a long snake or a sausage, and it should be soft. So that's kind of the ideal to sort of strive to. Now, I wouldn't suggest that people take laxatives or anything like that to do it, but I think the behavioral part of waking up, training your gut, having some caffeine or some food to stimulate that gastrocolic reflex, it's really well done.
There used to be an old joke that was going around about going at the same time every day and how it's like, you're one of those regular people. And it just always was. And I used to make the joke about, I ate food. I'm like a dog. Now I got to go to the bathroom. Give me 20 minutes and I'll go to the bathroom. Is that normal? Like if I eat, let's say if we eat something in the middle of the afternoon and then a half hour, 45 minutes later, we have to go. Is that okay?
Very normal. Okay. So that's, again, that gastrocolic reflex. The food distends the stomach, causes everything to push along, and then the stool comes out the back end. Now, a couple of things to keep in mind. If you've been sitting for a while and haven't gone, then it's probably a good idea to get up. So more than 10 minutes. Okay. Because people start scrolling on their phones or watching something or doing something else. It's fine because it helps you relax. But really, you want to limit the time there to no more than 10 minutes. Because if you're sitting for a long time, you can imagine your pelvic organs aren't supported. Right. And so you can have higher risk for hemorrhoids and such. Exercise, hydration, travel, sleep, all of these affect how our gut works. So our gut is like a little brain. And if we're sleep deprived, if we're stressed, if we haven't had enough water, if we drink too much alcohol, we take antihistamines, which are dehydrating. All of these things can cause constipation and problems with how the stool moves along. And here's the reason why we think pooping more often is better. Because the ones that pooped less often had a nearly 2-fold higher risk of dying early, of Alzheimer's, of cancer, and of heart disease. And the idea here is the gut is not just there to eliminate toxins, but it can actually create toxins. And they found a new toxin that occurs more in younger people that's linked to younger colon cancer that's created by the change in the bacteria. So if you're not going every day, you change the bacteria in your colon, which some of these bacteria make bad toxins that can then start to damage the DNA of our colon cells and cause cancer, cause inflammation, cause heart disease, even cause dementia because you're not eliminating those toxins from the body.
Wow, everything's so connected and we just don't think about it that way. So you mentioned most people aren't going on the regular. how bad is that?
It's pretty bad. So I want us to start paying attention to it. I want us to think about hydration, think about fiber, and fiber from natural sources like fruits and vegetables.
Right.
Think about exercise, think about meditation, and like we talked earlier, behaviorally sort of modifying your gut. If you're someone who's chronically constipated, you need to talk to your doctor. Similarly, if you're having 3 or 4 bowel movements a day, you probably have something called IBS, irritable bowel syndrome.
Yeah.
That's also something to talk to your doctor about. So really try to aim for that kind of 1-a-day Goldilocks zone. But also know that everyone's body is a little different.
Yeah.
So yours might be a little different, but gut transit time, how long it takes food that we eat to make all the way through, is a marker of health.
Okay.
And we don't know if it's just a marker, it's actually involved in causing disease if it doesn't move along.
So too often or not often enough is a sign we may have to change something in our lives.
That's exactly right. So Goldilocks, or they say Goldie poop,
Yeah.
is how you really want to think about it. You want to make sure you find that sweet spot of going regularly and really thinking of this as a marker of your overall health. We don't often think about pooping. We just
Right.
kind of go when we feel like it, but trying to train your body to do it at the same time, sit for long enough to completely empty. Because
Yeah.
if you're having to go multiple small times during the day, maybe you're not sitting long enough in the morning.
Giving yourself enough time.
Enough time.
Yeah.
Exactly.
Well, there you go. Next time you go, maybe pay a little more attention to how often and what's coming out and make some changes if you need to. Thanks for stopping by.